I'm recording with this computer. Perfect. All right, so as we're going here, we're also going to go to Facebook. And since you guys can see this video and I cannot for some reason, if somebody decides to answer with a chat, you guys can let me know. Oh, wait, there we go. Now I can see it, kind of, sort of.
You can see a chat. I can't see the chat, whatever.
I can't see the chat either, and I don't know whether it's going to be through here or through Zoom. So.
Oh, there is lag. I accidentally clicked on the video.
So Anthony, Anthony says you're live. We are a hot mess here right now. So, we are going to go live with this. For some reason, I cannot see the, whoop, I am looking at myself. Oh my Lord. Okay, I just closed out of that. So if you guys can't see the chat.
I see where Anthony says you're live. So if it's just comments, then I guess it means they roll in.
Okay, so if you guys can see comments, just shout them out. How's that?
Okay.
I think that might be the easiest thing to do. Okay. All right, so thank you for everybody for signing in today. We are trying to figure out technology as we are going through this lovely little experiment, so just hang tight with us. So we wanted to go through an athletic training Q&A with you tonight, just to kind of get a feel of what the athletic training program for rec sports was all about, as well as talk about some areas of discussion with some former interns of mine. So first and foremost, my name is Ashley Shepard. I am the athletic trainer for recreational sports here at VCU. I started the program about 3 going on 4 years ago, and it has only grown from there. So those that can remember, my office used to be about a little closet by the pool, and yeah, Alexis is laughing because she remembers. And we have exponentially grown to the point where we are now on the first floor, accommodating about 800 plus appointments per semester, which is awesome. So I'm going to have my interns introduce themselves, as well as kind of go through just a guided discussion. If you guys feel like you have any comments or you have any questions for the interns, just put a comment in the video and we can go from there. Otherwise, we're just going to have a nice guided discussion on their journey through the internship. So let's start with my most recent intern. Let's start with Alexis.
Okay, so hi, my name is Alexis Campbell. I'm a senior HPIC student in exercise science. And this internship, I did it in like the spring of 2020. Yeah.
And we're going to talk about some of the modifications that we had to go through.
Yeah.
My name is Imani. I am also an HPEX major, exercise science concentration. I'm also a senior, and I did the athletic training internship fall of 2019.
Awesome. So let's talk a little bit about the, we'll get into the experience and everything like that, what you guys liked and disliked, but let's talk a little bit about the application process itself. So do you guys remember going through the application process by chance? Because I could talk a little bit about it as well.
Yeah, I remember.
You remember? You want to talk a little bit on it?
Yeah, so with the application process for the internship, you gave me like questions, about 12 questions about what athletic training means to me. Mm-hmm. And so it was actually, those questions were pretty hard. Because
made you think a little bit, didn't they?
I had to think, because I was just, I don't know what, I mean, I knew what to say, but I didn't know how to make it just professional, like how to back why I wanted this internship besides just being it required. But after I kind of thought about it, why I actually wanted to do it, it kind of just came natural. And so I was just like paragraphs for each like question. It didn't take more than like maybe an hour, to do. Yeah.
Awesome. And then Amani, yours was a little bit different. So you want to talk a little bit on your experience on the application process?
Yeah, so I wasn't only Ashley's intern. My like whole internship was a little unconventional, where I was really, when people ask me what I did for my internship, I would say I'm the rec sports intern, because for majority of the time I was in Ashley's office seeing her patients and everything and observing her. But other than that, when I was outside the office, I would be doing shadow shifts. I would also be shadowing in the main office upstairs, seeing what they would do for rec sports on that end. And so I was kind of all over the place. But I would mainly claim, like, Ashley as kind of like the home base, because I did majority of my hours with her.
I claimed her. That's what I did.
Yeah.
It was always like, you can go where, like, other places if you want. And I'm like, no.
Let me just sneak in this office a little bit, right? So let's talk about the decision you guys made for athletic training in general. So you guys were able to go through with Dorito, who is the clinical coordinator for the HPEX program, and you're able to identify several different internship opportunities that y'all wanted to do. What made you want to go after my internship versus, a PT clinic or a gym, that type of thing?
Well, for me, before I had this internship, I met you before playing club lacrosse.
Mm-hmm.
So you already were a cool person to begin with. And I already knew I wanted to go in athletic training that direction, because I was PT, but then I realized PT is kind of like, you have to specialize for athletes if you want to do PT. So I was just like, no, I don't want to do that. And I also did an athletic traineeship before I came to VCU, so I like that. So I liked athletic training. And so I was just like, well, I knew varsity. I didn't get accepted to the varsity athletic training. So I was just like, okay, let's talk to Ashley, because why not? But
because why not? Exactly.
Yeah, it was
definitely interesting.
yeah.
So, Monty, what about you? Because we talked about how your experience was a little bit different. So what made you want to experience the athletic training program?
For me, I've always just been, I didn't really know too much about athletic training. And so as an intern, I wanted to take that opportunity to really dive in and just educate myself on something I didn't know, because I've always been just interested in just the rehab idea of everything. So I've always also been PT centered, like being like, oh yeah, I want to go into PT. But I also wanted to make an informed decision and make sure I know about other professions. So athletic training, and that's what really attracted me to Ashley. And because I think I was supposed to only do about 60 hours with you. And we'll
Something like that, yeah.
something like that. And I guess we'll talk more about how many hours I'm supposed to do, or we're supposed to do for this internship. But what attracted me to Ashley was seeing what she can do, especially in the academic space, which sets her apart from other rehab specialists in the area and on campus, because she is in our gym, but which most people don't know.
And especially since the office moved, yeah.
Yeah, I'm she's right there, you guys. You pass her all the time.
Yeah, yeah.
But being able to see what she does and see, and specifically in the environment. So she's more than just an athletic trainer in that setting, and that was really intriguing to me about her job.
Awesome. So let's talk about, so Monty, you mentioned the hour requirements. So both of you were able to do the experience with the 395 class, which required you to do 120 hours. So do you both want to speak a little bit about how we were able to, one, modify the hours with the COVID experience right now, but also how you were able to divide your time with at homework, because we had assignments and everything like that. So let's talk a little bit about division of time with the athletic training program.
Monty, did you want to go first on this one?
Oh yeah, because
it's too fresh for her right now.
So for me, for HPEX 395, which is our interning class, we're required to do traditionally 120 hours with our supervisor. It's mostly observation based. So during my time with Ashley, I would literally watch her with her patients. I watched a lot of baseline concussion tests because it was the fall, so everyone's getting ready to play their prospective
6 weeks of
sport.
it. Yep.
Yeah. I was like doing it with them. I'm like, let me close my eyes.
Yep. I think day one, I gave you a scat form and I was like, look, I want you to memorize that. A couple days you came back and you were like flipping through with me and we were discussing it afterwards. So, yep.
Yeah, I would count with you, like count to 20. I'm like, oh, she's a little ahead of me. So.
Yeah.
And so you just watch. I watched a lot of evaluations. I think my first one was an ankle eval. I got to watch shoulder evals, knee. I can't remember. I think all the major joints. I got to see some tapings. I got to learn some tapings because of my homework assignments. And as far as balancing it with classes goes, it's like being in that setting really inspired me to think of how to present it to Ashley. So I would do a lot of thinking there and putting it together at home. And then also sometimes when it came to taping, because there was a taping test, it just came to asking for help because I was like, I could do what I could.
You are not the only intern to be nervous about the taping test. And my other intern, Destiny, were going through it too. And
we're like
them both sitting there, and I was like, okay, who wants to go first? They both look at each other and they're like, please say something. Please don't let me go.
At least y'all had each other. She'd be like, do you want to do it now? And I'm like, hoping the door is like gonna burst open with an emergency. I'm like, oh my god.
But it never did it?
No.
Well, with Amani's experience is like, I guess, the polar opposite of mine. Well, because just like the COVID-19 thing. So I did get about 70 hours before we had to kind of go online and virtual. And I was in the morning, so I saw a lot of club members, like with ankle, back, knee, hip, yeah.
Basically every joint.
Yeah. I was just like, man, it was a mix between people who knew how to like rehab and exercise, and there was a combination of people who kind of did not know how to like begin. And interesting with my internship, because I took it with one of our HPEX classes, musculoskeletal structure. Whew, what a class. So I think those two classes, the internship in that class kind of fed off each other, because I would always have questions in that class and I would always ask Ashley, and then my Destiny, the other intern as well, we would always ask Ashley, what does this mean? You know, like,
right.
If for like 374, which is the class, is like concentric and eccentric muscle actions.
Yep. But now
Actually, I understand it now, but you need like a second opinion on stuff. And once we progressed into like online because of COVID-19, we looked at Ashley's work out of the day sessions, so we would actually participate in the session, or I would, because I mean, what else did I have to do at home? Because
classwork.
Yeah. Besides classwork, obviously, and we would have discussion questions about how this could benefit other populations, how you felt about this class versus my normal gym routine, how to incorporate this with other like populations, because workouts at home are really important, just like going to the gym and other, like, it's applicable to all, like, athletes, general population, which like just regular people who go to the gym. It applies to anyone, so it's really nice to have that kind of knowledge, because sometimes home exercises are the last thing people think about when it comes to exercising. They're always just like, gym, 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 gym. What are you doing? So it was just nice to like have a second option in case gym is not like good for a lot of people. Yeah.
Absolutely. And it also depends on like monetary values, if the individual has them. So like for me, I haven't had a gym membership in, not going to date myself, but like, let's say 5 years. And I have just worked out at home, little bit in the gym if I get a chance to, but it's interesting that you bring that up, because I think one of the things that surprised both of you was the way that we do rehab with the HEPs, the home exercise programs. So let's talk a little bit about the HEPs. How were you surprised by them? Did you think about rehab in a different light other than, hey, let's get them into the gym, let's have them do 3 sets of this? And so let's talk about the HEPs, your reaction to them, as well as how do you feel about them now versus in the beginning of the internship?
Well, for me, I've never done anything at home that was serious. I would always go to the gym. And I found out HEPs are harder because they're body weight exercises. And I'm just like, wow. I was trying to do like the tricep dips. And I was like,
Yep.
I can't do that. I was like, I can't do that.
Come to class
So
tomorrow.
it was, yeah. So yeah, I was just like, wow. And like at the gym, when you're on a machine, like you can lower the intensity so you can make it easier, or you can make it substantially heavier. But with body weight exercises, which is I guess the main focus of HEPs, you can't change your body weight to make it easier. So you kind of have to do it, the exercise more efficiently, so you know how to like, so it can be easier for you, but not kind of cheating. With rehab wise, I liked it. You can use stuff at home. Like, not everyone has a resistance band. Not everyone has dumbbells, plates, weight plates. So you can use like a heavy book, towel, t-shirt, sweater. So anything that's weighted, that's safe. So it's very accessible, and it's, there's stuff that you think that you would need at home, but you just really need stuff around your house that you should
absolutely
have.
What about you, Imani?
Yeah, I totally agree that when it came to, I think I was really inspired because I took 395 with exercise programming. And so up until that point, they're really focused on teaching you about training someone in a gym setting. And it was kind of ironic that we're in a gym and we're talking about working out at home. But it also comes back to that idea of access, which is what I really liked about the home exercise rehabbing, because it makes people feel like I can do this, and one, I can do it at any point, anywhere. And so it really does put people in control of their lives again. And I think that's one of the things that really attracts me to rehab in the first place. So even in exercise programming, I would kind of be like, how could we're talking about like our case studies would include like someone that's elderly or someone that's never worked out before. And I'm like, well, how can we incorporate something that isn't a deadlift, you guys?
Absolutely. Yeah. Something that we talked about this semester with my interns was the generalized preface that y'all are facing is you are given healthy individuals or individuals that want to build strength or have, some experience in that case. Something that we talked about was your teaching style. And I pushed you guys to be able to understand that teaching styles are totally different. My way of explaining something is totally different from this person's way and that person's way. And so we were able to kind of take that information and kind of push you out of that comfort zone, which was awesome to see you guys. First day, a little bit shy, didn't want to, raise your hand. And then by the end of it, you were like, boom, I got this. Let me tell you this answer. Let me tell you how to do this exercise. Let me tell you, I want them to be doing 3 sets of 5 in order to build strength. It was awesome to see you guys be able to kind of blossom within, I don't even know how long a semester is anymore. It's been so long since I've been in school, but I think it's around 14 weeks, maybe.
That's close. I think ours is 16.
Close enough.
It's like 16.
Yeah.
Something like that.
Yeah.
It's been a long time. So being able to kind of learn about the home exercise programs is great because it takes you out of that mentality of, okay, they can do everything. Well, no, now we're throwing, a monkey wrench in the gears, if you will. We have a person with some limitations. We have a person with possible osteoarthritis, with chondromalacia, with a different type of either injury, illness, whatever. And being able to kind of take that information, bring it into the home setting, because not only does it allow the individual, for you guys, to be able to think, okay, I can't do this, but maybe they can do this, and kind of modify it in that way. But it also, like Amani said, it kind of allows the individual to have autonomy, and it makes them in charge of their individual rehab, which is great. Something that I like to do is get to know the individual. So I've been through PT twice, one for my ankle and one for my knee. And unfortunately, that's how I got into athletic training. It's kind of a blessing in disguise, I call it, where I was rounding first base on my first good hit of the game, my junior year of high school. Heard the loudest pop of my life, turned out to be a high ankle sprain, went through physical therapy for it. My PT was noticing how interested I was and how I was willing to kind of modify my exercises so that I could do them at home, because I think both of you have been in a PT clinic before, correct?
Mm-hmm. Yeah.
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 Kind of.
Not like for like an injury, but like for like a tour. So I don't really count that.
Gotcha. So PT is a little bit different because they'll give you several exercises and tell you, come in, do these exercises, then go home. They don't really stress a whole lot about doing HEPs or home exercise programs, which is a huge deficit to the individual because they're not getting that full experience. They're basically relying on somebody to give them more exercises and everything like that. When an individual has an injury, they want to be able to feel that autonomy again, because something that's out of their control is they're living with it every single day. And so having that control and the ability to do their exercises, one, HEPs are great because I like doing them. You can find anything around the house. I've done rehab with 2 kitchen towels as I was doing laundry before. I've seen people do it while their kids were taking a nap. I've seen it while somebody was washing a car, believe it or not. Like, we were able to do rehab as they were waxing their car, which was awesome. And it makes you also think that it's not work. It's something that you can incorporate into your daily life. And that's something that I really stress with those exercise programs as well is, hey, you have a 3-hour class, do a couple exercises before, do a couple exercises after. You fit it into your daily routine as much as humanly possible, which a lot of people really love that, because then they don't have to worry about scheduling in rehab. They can do it whenever they want. And they have the ability to kind of fit it into their daily routine, which means they're more likely to do it in the first place, which is awesome. So next thing I want to kind of talk about is clinical experience versus on-field experience. So you both were able to go through both experiences, on-field or on rink. In Alexis's case, she was able to come to hockey during one of the games.
Oh, cool.
And Amani was able to attend our Capital Cup event, which is typically in the fall. And so I want to see your guys' interpretations of in-clinic versus on-field, because that was definitely something different for both of
you. Yeah, it was.
It was different.
Yeah, we were outside. We were outside. I think the biggest difference, especially because I'm still observing you in both settings, but there's this level of hypervigilance in the outdoor setting, and when watching lacrosse, because it's like these sticks are flying, they're running. I'm just like, how do we keep up with things? And then there actually was at one point what we thought was going to be an injury, and you were like on it, and I was like, oh my gosh, it's happening. It's happening. And so I think instead of kind of like the clinical setting where we're getting a rundown of their interpretation of how they got their injury and their mechanism of injury, and figuring out what, like, from evaluations where to go from there, it was kind of like on the spot evaluations. Can he still play? Yeah, he's fine, let's go. And like continue to watch. And it was not very intense, but it was still intense. It was way more intense than clinical.
Yeah, absolutely. And you were basically able to see, for both of you, a lot more aspects to immediate care. So not only doing injury evaluations, but also, hey, this kid's got some turf burn, let me clean up this blood a little bit before they're able to go out on the field. Different things like that. Whenever we were doing Capital Cup, it was November and it was cold. And so that's something that was totally different, was the
Freezing
climate, and just being able to, me, I got my parka on, I got my long, swishy pants, I call them, my ski pants, and I'm bundled up to the T because I am always cold. So definitely something that was different with Capital Cup is the game was late at night. We had the lights going, the sounds of the city, versus in the clinic, you have almost kind of cut off. We don't have windows. We have patients kind of coming in and out. We see their file, we go through their rehab, or we do an evaluation, and then we send them out the door, kind of almost like a rotating door type of experience. So what about you, Alexis? What were your thoughts and determinations of the on-field versus clinical experience?
Well, I kind of like both. So I got to see ice hockey and I got to see lacrosse. I'm familiar with lacrosse injuries. Like, I know concussion, turf burn, blood blisters, checking. I know all of that. I've seen it all before. It sucks. So I was prepared for that, to see, like, I knew what to look for. And also ankle sprains. So I kind of knew what to look for, especially for men's lacrosse, since they're kind of juking more often. So, and I was happy to see it. It was really awesome. But for ice hockey, I've never been that close. I've always I watched the Caps, but from far away. So it was kind of cool seeing actually it up close, and it was very cold compared to the clinic. But it was doable. Still intense, because with ice hockey you have normal mechanism injury, like pushing, shoving, but you also have the skates. So that's the biggest factor to, I guess, you were watching, because I don't think it happens often, but if it does, it's a very serious issue. And just seeing what the guys needed, like what they use for before games, it was very different. It was interesting, but very different to see compared to the clinic, where people are already injured or suspected of an injury. So you kind of know what to do from there. So there's no kind of alert. So you're just kind of, the mood is chillaxed and you don't really have to worry. Patients are more comfortable and they have more privacy with their injuries compared to on the field, where they have the team, the other team, the spectators, us, the interns, actually. So it's kind of very nerve-wracking for them, because if they are injured, they don't want people to know they're injured, because when people get injured, they tend to get very uncomfortable, very reserved. They kind of shut down a sense, especially when they're under that spotlight. But in the clinic, they're willing to describe and to talk about the injury a little bit more.
Yeah.
And Ashley does a good job educating them on the injury and what to do. And so she gives you the rundown of anatomy without the hassle of anatomy, So that's always good.
The layman's terms, as we call it. So yeah, I think that was something that was interesting for both of you, was how much education the students were able to get, because a lot of physicians and specialists and everything like that, you're used to going into the clinic, they do an evaluation, they give you a diagnosis, they send you out the door, they refer you to PT. So a lot of people, especially nowadays, don't get that one-on-one care. They don't get that education where the person physically points to a chart, tells you exactly what's going on, why the mechanism of injury matters. So mechanism of injury, in case people don't understand, is basically what happened, the event that led up to that event where the person was injured, taken out of play, regardless. And so for those of you who haven't seen the athletic training room, we have a bunch of charts and pictures and everything like that up on the wall, where an individual comes in and they are able to be evaluated. We give them their prognosis, what we think is kind of going on with them, and we tell them why that's going on and what we're going to do to fix it. And I think whenever we first had y'all come in, I called it the light bulb effect of, you're going to see a person kind of being confused and tilting their head, but then the light comes on and they're like, I got it. Now that makes sense why I'm walking upstairs and it hurts, versus, trying to run and that's why it's hurting here. So let's talk a little bit about reaction to the education in the athletic training room, and has it changed your way of care whenever you're talking to patients, future patients, individuals, everything like that?
Yeah, because I really love the education aspect of like what you do for your clients, because I feel like that's the most important thing to do for people, because you hear a lot of stories about people going to the doctor and saying, oh, they said this, but I don't know what that means. And then that's it. So I feel like that's so unfortunate, because you went through so much schooling, so you do know it as a professional. So I feel like it's a duty to have that information to your clients. So for me, like, since I'm pursuing like a CSCS, which is like a certified strength and conditioning specialist certification, and you should tell your clients that you're doing this because it's going to strengthen this particular thing, which does this type of motion, which will help you in your type of goal. So the more the patient or client knows what they're doing, the more adherence to the program or whatever they're doing for that person. So I feel like it's very important. It makes me want to help know more, so I can tell the client more, so they can be better off once like whatever we're doing is done. So
Yeah, absolutely. What about you, Amani?
I completely agree with Alexis's last statement, where it's like you want to know more so you can tell them more, because you don't want to just, like, I think a part of education is also a part of access, like you don't want to leave that information out and not allow people to understand like the why behind their injury and the why behind their treatment, because it all goes back to putting those people in control. Like you were talking about, Alexis, when people get injured, they feel powerless a little bit. They're not themselves, because their body's doing something that they didn't anticipate, and they can't do what they want to do. And so even now with my current internship, because I get to work with people with chronic injuries, chronic lower back pain, it does change how you talk to them, and it makes you can tell that they're a lot more at ease when you explain the why behind what they're doing for their treatment and what we're doing in the research lab that I intern with.
Yeah, absolutely. And I mean, I've been on one side of that where I've had, a physician, whenever I tore my meniscus, I told you both this story, going to give a real description of it right now, where, yep, I'm telling the story, where I knew I tore my meniscus because I did a special test on myself that I was able to perform. I went into an ortho clinic when I was doing grad school, when I was a GA in my grad school. And I told the individual, look, I'm an athletic trainer. I did this test on myself. It showed a positive test. I have a tear in my posterior lateral meniscus. I just need your referral in order to get an MRI to determine if I need surgery or not, depending on how big it is, where it is, location-wise, everything like that. I had that individual look at me and just kind of play with my knee a little bit, barely even touch me to evaluate me. And they just said, I think you just kind of tweaked it. Maybe if it happens again, come on back. That to me, especially since I was a healthcare professional at that time, I was very upset because it made me feel, one, like that power was kind of taken away from me, like you just mentioned. But two, that, I mean, almost like you didn't believe me. Like, why would I make this stuff up if I'm coming into your clinic? So unfortunately, 2 weeks later, I had another accident and it tore even more. So I was able to be referred at that point. And then, what do you know? I have a posterior lateral meniscus tear, and it was a hot mess, but that's another story for another time. So I do agree, like having that education and giving it to people, it makes them feel, I feel like it makes them trust you a little bit more. Because if you just say, hey, you have a lateral ankle sprain, just do some rehab, you'll be fine. It doesn't really give the person a whole lot of information. What are their limitations? Why is it hurting whenever I'm doing these things? What was the mechanism of injury? What ligaments are affected by this injury? And by breaking it down, and I actually have those pictures in my office, I show the individual, hey, these are the ligaments I believe that are being affected. This is the musculature. It's almost like that aha light bulb moment where the person is able to kind of put the pieces together for themselves. You give them all the puzzle pieces and they physically are putting them together in their mind, which is awesome to see. And, using the layman's terms, so shoulder blade instead of scapula, and, instead of tibia, shin bone, those types of things. Is also really great, because if you spit out all these, anatomical terms and medical terminology, one, the person's going to pretty much be, okay, whatever you say, I believe you, I guess. But they're also not going to understand it. They're going to take that information, like one of you said before, I can't remember which one you said, and just kind of not know what to do with it. And I've had a lot of patients, unfortunately, that have that, where they go into minute clinics or patient first or anything like that, and they get told, hey, I think you have this, but they don't have any information on it, unfortunately. And so that is our responsibility as athletic trainers, to be able to go through, figure out what's going on with that individual, give them rehab in order to get them better and back to play as soon and as safely as possible. But also eventually maybe doing some prehab, some pre-rehabilitation, in order to prevent this from happening again in the future, if it is something that can be preventable. So yeah, absolutely. I agree with both of you. The next thing I want to talk about is with your specific internship. So there's a project that you had to do that lasted the entire semester. So you guys want to dive a little bit deeper and tell us what your projects were and how we were able to kind of work in the clinic as well as outside the clinic on how to get them done and presented accordingly?
Did you want to go first?
Yeah.
Hers is too fresh. She just finished hers yesterday.
Yeah, basically.
Yeah, let's give you a break. I think for me, what I ended up creating was an infographic for Ashley about 4 people that didn't know too much about athletic training and didn't know that she was a resource for them that was in rec sports. So I asked her frequently asked questions. It had contact information. It had a basic breakdown of what an athletic trainer is, what kind of education you need to be an athletic trainer. And what we would do is I talked about in the clinic, be like, okay, this is what I want to do, and had an outline on the board and everything, and then would work on it at home, email it to her, and so we could talk about it when we would see each other next. I think that's really what I did for mine. I was really inspired by people asking me why they would see me in the gym in like business casual, business professional attire. They're like, why are you in the gym? And I'm like, I'm doing my internship here with the athletic trainer. And then they'd be like, what?
Mm-hmm.
Yeah. I agree with that, like that last bit, because a lot of people I go, like, who are in my class, they go to the gym and they see me and they're like, I didn't see you work out. Where are you? I was like, I'm at my internship at the athletic training room right here. But for me, my project was I created a 6-week rehabilitation program for like women's lacrosse. So I played like lacrosse for about like 6, 7 years. So I kind of knew what are the common injuries. So I divided that into upper and lower body, broke it down to like the muscles, their actions, and explaining like in the layman's term, like what does that injury mean and how that injury could have happened in a lacrosse game. So at the end, I had exercises and stretches that pertain to those injuries that can strengthen it, that you can do at home, at the gym, or on the field. And I would like mark which one was best suited in which location. And then also gave them like a sample program plan. So week 1, you should be doing light exercises, 3 medium, 4 heavy, 6 resist, and you should be like heavier.
Mm-hmm.
So yeah, that's basically what I did. I included a lot of pictures because I feel like that's also important because it was all like a PowerPoint.
Mm-hmm.
So instead of getting like a whole video, I just put little pictures about what does flexion mean, what does abduction mean, what's a plank, what's a lateral raise. So I just gave that so they can refer back to it and also can see it in the picture and the text form. So they have both options.
That's really cool.
Yeah, absolutely. And something that's great about those projects is, and we talked about this in clinic, is you can take those, laminate them, put them in a binder and present them as a part of, let's say you wanted to go into an entry-level master's program. You can use that as a kind of gateway into, hey, I was able to take this information, I was able to utilize it in this way, because that's really impressive. Both of your guys' projects were great and pretty much beyond your years of being able to take info that you were able to obtain in the clinic, outside the clinic, and pretty much figure out what people need and how can I use my education in order to get them the information that they need without having to Google it, going down the rabbit hole of the internet and trying to find the answer that might be right. You were able to actually identify what people wanted to know and kind of getting them that information right then and there in an easy format too. So I believe, Amani, you did like a pamphlet and an infograph, right? And then Alexis, you were able to do PowerPoint. Those are things that people can very easily utilize at home, but also you can use them for job interviews. You can use them for resume builders. So it's definitely great on both of your ends, being able to utilize that information, being able to get that to those individuals. So let's talk about next steps. So we're seniors right now, right? We're going through the HPEX program and all that good stuff. So what has the athletic training internship helped you kind of realize? Did it help you at all? Did it help you kind of identify what path you wanted to take? And if so, what is that path, I guess?
For me, the athletic training internship kind of helped build my confidence about the knowledge I've learned in my HPEX classes, because in HPEX you learn so much, and it's just like, it's really hard to retain stuff. But with this internship, I got to apply that knowledge. So especially with anatomy, physiology, and then musculoskeletal movement, I got to apply those very difficult topics in like a real world setting, so I can learn it on a different level than just being in the classroom. Because I feel like the classroom is awesome to learn, but having that hands-on, but not really hands-on, observation hours is very good for me, because I can like it kind of solidifies what I'm learning. It makes more sense, and I feel more confident to apply it to future things. Yeah, I lost my train of thought.
You're good.
But it helped me kind of just develop more ways than just, just be an internship, actually.
Yeah. So with that, do you know a better idea of what you want to do future-wise?
Yes, so I know I want to do athletic training, but I wanted to do maybe sports psychology as well, because I know, it really, I guess, resonated with me how you researched some conditions your patients have to better understand them more. I really respected that, and I also respected how, like, sometimes you just don't know what a person's been through. So to take that step back on a human level, just to understand them, to make them go forward with their program is very, it's respectable. Like I wrote in my essay. I was just like, that's like awesome. That's so great, because at the end of the day, people are clients, but they're also human. So they have emotions, they have goals, they have wants, they have fears. So I wanted to do athletic training and also like some sports psychology or exercise psychology, so I can see, or something psychology, so I can have the best of both worlds, because not everyone's like a robot.
Yeah, and that's something we talked about in the beginning of the internship was, what education do I have? Like, who am I to tell you this information? So for those of you that don't know, I actually have 3 degrees. I have my bachelor's degree in athletic training with a minor in exercise science. Halfway through my master's degree, I obtained my associate's degree in psychology, and then I got my master's degree in sport and exercise kinesiology with a concentration in exercise and sports psychology. And so the reason I got 2 psychological degrees is because whenever I went through rehab, I knew that there was an instant connection, mind, body, there is definitely a connection. And so we talked a little bit before about, what is that connection? People get depressed, they get very anxious and nervous. They don't want to try new things because they're worried about it aggravating their injury, especially if they don't have a lot of information and education on their specific condition. And, throw on something on top of that, if they do have PTSD, if they have anxiety, depression, and they're going through therapy on top of that, you want to definitely make sure that anything they need, or if you need to make accommodations for that individual, that you kind of understand their condition, as well as just talking to them. I feel like sometimes we try to just know everything and oh yeah, I've heard of that, let me see if we can. Honestly, I learned the most out of people's individual needs just by talking to them and just saying, hey, this is how I usually conduct my rehab. This is how we're going to do this. This is, what we're going to modify your conditions in order to do. And if somebody has an issue, I want to break down that personal level with them where I'm not up here and they're down here. And it's almost that we're working together in order to get them back into play as safely as humanly possible. And by having that, I found it's more beneficial for me as a clinician. I have less headaches and frustrations and trying to understand, what can I do for this person, because I want them to get better. I work very hard to make sure people get better. But also the individual doesn't get frustrated because you're taking time to understand what they're going through and make those modifications if they need any at all. And just being able to look at them as, oh, that's my knee injury, that's my shoulder injury. No, I know, stuff that they're doing on the weekends. I know, if they're hanging out with their parents, if they have a test coming up, how did they do? And for me, just breaking down and having that personal level with my patients, I find that it's better because they're more relaxed when they come in the clinic. They're not super uptight and nervous. And I always tell people, if you didn't do your rehab for the week, cool, just let me know. And then we're going to work on it and just build it up again. It's not a setback. It's more of an obstacle that we need to overcome. So having that little bit of a psychological background is great, especially since now they're trying to get more psychology background into athletic training programs, because when I was going through school, we didn't have anything. I believe I had to take an abnormal psychology class as a prereq core competencies for the university. But other than that, I was not really given a whole lot of psychological information. And so for me, I wanted to be able to give my patients that extra attention because I feel like they deserve that. So definitely commendable on you for that. If you have any questions, definitely let me know. I can give you some info
Okay.
or some contacts if you want to pursue that. So awesome.
Thanks.
What about you, Amani?
I forgot the question.
Next steps. What do we got on the horizon? What kind of job prospects are we looking at? Schooling, what have you?
So I do think I still want to go into physical therapy, but right before, we were forced to be in our house, our home. I
You got
was
the
actually
opportunity to stay.
We have the opportunity to help with the pandemic by staying inside. I was
Social
interested
distancing.
social distancing. I was hoping to be a rehab technician in the hospital, actually, just to be exposed to something more intense. I don't know why I like an organized chaos, but I do. And so I definitely wanted to be exposed to more patients because I've done, after being in your clinic and even before that, I've shadowed in orthopedic settings. I think I wanted to be exposed to different types of patients and different types of injuries. And I definitely have, I think you're the second athletic trainer I've ever met, and you both were very cool people if she ever sees this. But I definitely have a new perspective and I'm way more educated on the profession, and as a future healthcare professional, can't wait to be a part of a rehab team that is inclusive and is understanding of everyone's strengths.
Yeah, absolutely. And just being able to have that background in different types of rehab. So we talked about being able to go to a gym and having somebody to work with, knowing those limitations and being able to, I have a shoulder injury, so I can't do this today. No, actually you can. We're just going to modify it, and being able to kind of break down those barriers so that as well as I do, I don't like to say no to people. I don't like to tell them, oh, you can't do this. I always like to say, well, no, we shouldn't do this because it can further injure you. However, we can do this.
Mm-hmm.
My line of thinking is, I don't care what kind of injury you have, you always, always, always can do some kind of rehab to make sure you get better. Even if you are in a full body cast, you can do blinking exercises. And so having that mentality, a lot of people, especially now being injured, have the mentality of, oh, I can't do anything. I got an ankle sprain. I can't do anything for 6 weeks. No, actually, that's not true. You can definitely do rehab, upper body work, core work. You can definitely strengthen the muscles around the area. And having that alternative type of therapy is great because you're going to be able to give and that key that they're going to be missing, and you're going to be able to sit there and educate them on, yeah, you can do this, you can do that. And a lot of people are going to be thankful for that because they are going to be able to be comfortable in doing those exercises, performing those things, but also now with the alternative types of therapy, being able to give them HEPs, home exercise programs. So maybe you can't come to the gym every single day. However, do you have these 3 things at home? Do you have a flight of stairs? Do you have hardwood floors? You can absolutely do rehab with just those 2 things. No equipment absolutely necessary. So awesome. I think both of those are really good avenues in which you are ready to pursue. And I'm very proud of both of you for being able to come through this program and grow the way that you have and ask the questions that you have and be able to kind of connect the dots, if you will, between the clinic and the classroom and kind of feeding off each other. Something that we were able to implement this year or this semester was being able to identify biomechanical issues that individuals were having in the gym, and what injuries can come out of those. And so my interns both loved being in the clinic, but they also wanted to get out and about. And so we took some walks around the track in the gym. We were able to kind of dive a little bit deeper into the connection between the clinic and the classroom. We were able to get into the gym and take a half hour or 20 minutes even between clients, go around, and we were able to kind of modify exercises. So if an individual had lack of range of motion or something like that, we were able to make modifications to exercises. But also, could we identify people that were doing exercises either incorrectly or they were trying to modify them themselves but could potentially injure themselves? What they were doing, how it could injure them, as well as how you as an individual would take that and make sure they understand that information. So either lowering weight, working on hip flexor mobility and flexibility, those types of things. And so that was something that made me think outside the box a little bit, because I'm used to being in my office. I love getting outside my office and being able to play around with those types of equipment. So the last thing I want to touch on is you both have been through the program. You both have gone through 395 in all of its glory. What advice would you give to future individuals that want to come into or apply to the internship, or even just if they're interested in athletic training in general?
Don't be shy. Even though that's easier said than done. With this particular internship, you're not intimidating. Sometimes being with people who are dealing with athletes are very intimidating because they kind of need that a little assertiveness. But obviously, don't be rude to her clients. Don't do that, because her clients are here, and you're kind of there because they're there for a reason. You are, but priority happens. So just don't do that. Be comfortable asking questions, because this is an internship. Like, this treated just like a class, essentially. Because I had homework, so expect it's not easy, but it's rewarding, because if you come with like a million questions that you have from like outside sources, like the classroom, your own injuries, your friends' injuries potentially, you can use those questions because you have a professional resource, that who's willing to talk to you without payment, So it's just like, second thing, I think that's it. Be professional, respectable, not timid. Yeah, I think that's pretty much it that I've seen.
Awesome.
Yeah.
What about you, Amani?
Alexis said a lot of good things.
You're just going to piggyback off of her answer.
I do co-sign on just about everything she said. I think my last tidbit would be to be open. It is a graduation requirement, but go in being a professional learner. You just because you might be interested in athletic training, but don't think, like we just talked about, don't think you know everything. And then don't be afraid to fail. Don't be afraid to ask your dumb question. Don't be afraid to try, like, ask, to try something different, especially with homework, or talk about things that are not necessarily directly related to what you just saw in the clinic or what you saw outside in the field. And I think that is my biggest thing. Alexis covered a lot, but just be open as a learner and be able to absorb just about everything.
Yeah.
I would definitely highlight what you just said, Amani, because oh my God, I know me and Destiny, we're so scared to say a wrong answer, because Ashley would just kind of throw out some questions about muscle origin and insertion.
Yeah, you
And
wouldn't
then we
impress
would
her.
look at her like, what? Like, what? And then we'd just be there like, I don't know. But we didn't really want to say we didn't know because we've learned it, but we just don't remember it.
Yeah.
And that was a hard hurdle to get over because no one wants to be wrong, especially, and that's if you're passionate about it. No one wants to be wrong. But either way, it just makes you learn. Like, once you just accept that you just didn't know it, you can get past that, but you learn from it. You learn what to expect. Because if you don't ask those questions now and don't understand it now, you can potentially have that same interaction when you're a professional. And no one wants to go to a professional who doesn't know something because they don't try to learn from their mistakes when before they got like certified. So I agree 100,000% with what you said. Yeah.
And
Totally.
the thing about failing too, especially like I think what I've learned from both my internship experiences now, like learning how to fail gracefully is a very, very important thing, because even clinicians don't know everything off the top of their head. They're not Google. You know, we're all human beings, and I think that's something that even Ashley being like, you know, that I have my textbooks here for reference, and if you want to look through them, you can. And if I need inspiration on wanting to switch things up, or if I want to check it on, like, I want to use a different test with this person that's coming in, let me look over in the textbooks for inspiration. Those things, those resources are always there too. So to be able to confidently be like, I don't know, but I will find out, is also really important to my education moving forward, and to anybody that's looking forward to working with Ashley and working in this setting for their internship.
Yeah, I agree. And we talked about how something that was great about this internship is there's always room to keep growing that information. So yeah, you think you know a special test about the knee, awesome. What else could you do? So maybe this person was inconclusive with that one specific test. You know, maybe let's try something else, get them a little bit more comfortable. Maybe they're muscle guarding, maybe they're too swollen, you know, something along those lines. So I think it's absolutely, I always encourage people to keep learning. So with my background in athletic training, I wasn't totally satisfied with just sticking with that knowledge. I wanted to learn more. And so that's why I got the degrees in psychology. Now I'm working on my yoga certification to become a yoga instructor, my 200 hours, and actually an athlete specialization, which specializes in breaking down the biomechanical implications of an individual, seeing if they have a muscular imbalance, if they don't have stability, and kind of fixing it. I like to kind of dabble in different areas, bring them into my clinical practice, because I feel like it makes me a well-rounded clinician. I'm able to give them multiple different options, but then you're also able to see things in different lights. You're able to kind of look at things a little bit differently and not be totally tunnel vision towards, hey, I think this is a knee injury. Maybe it's an ankle injury that's unstable and it's going up the kinetic chain and it's, you know, affecting the knee now. So it allows me to kind of look at things in a different light, because you're both right. We are constantly learning things, and you know, 100% of the time you aren't going to know the answer. You're going to try different things and, you know, different strengthening techniques and different rehab techniques. And maybe something isn't working. Maybe the individual doesn't like it or doesn't understand it. So it's always good to kind of research things out, come up with a game plan, be able to have those different alternatives in your little bag of tricks, if you will, and be able to modify things as need be. But also you're able to bring things to the table that a lot of people might not have. And so right now, the new trend is being a yoga instructor and having those 200 hours. I see that multiple times on social media sites that specialize in athletic trainers, because they're finding that a lot of the movements and breathing techniques that yoga incorporates have to do with the human body and the mind-body connection. And so I thought that was interesting because I did it because I really like yoga. I wanted to do something different with my techniques and this and this and this versus, oh, I didn't really think of the biomechanics of the human body at that time. But now that I'm diving a little bit deeper into that certification, I'm finding that it is definitely more helpful, specifically for people that have lower back injuries and chronic back pain. So it definitely helps them a lot more. All right, anything else that you guys want to say or talk about, anything like that?
I don't know.
Or questions for each other. I'm going to put you all in the hot seat now.
Okay. So Amani, since you worked in fall, I know you said that there was a lot of concussions, baseline concussions. I probably saw like maybe 2.
Mm-hmm.
So what was the trend of injury besides concussions? Like what other injuries was like most common that you did see, if you can remember?
Shoulder.
Okay.
A lot of shoulder injuries.
A lot of shoulder.
Repetitive shoulder injuries.
Yeah, for sure.
Yep.
Yeah, what about you?
For me, I would say it's lower extremity, like shin splint. Like I wouldn't say, well, for the lower extremity, like it could be a combination of hip, knee, or ankle. But I want to say like knee to ankle, it's the most. There was a lot of problems, shin splint, sprains, like plantar fasciitis, abnormal gaits. There's a lot of those.
So
couple back.
different.
Yeah, it was
literally the opposite.
But why is that though? So this is a good teaching lesson. So why do you think that Amani saw more upper extremity injuries and you being in the spring saw more lower extremity injuries?
It could be because a lot of, well, I don't really know because like I know in high school there's like spring sports and fall sports, and spring sports consists of lacrosse, soccer, a lot of running sports because they can run outside because it's warmer. But I don't know if VCU follows that trend. But
that's what I was thinking though.
Yeah,
slightly. So with us being rec a little bit different, so we don't have the stereotypical fall sports and spring sports, but we have those times where different sports are more active. And so in fall, we have more sports that are going on where they do have more upper body things. So swimming, crew, we have a lot of lacrosse going on during that time and training, versus in the spring, soccer, all those types of things. Rugby happens during both times, but predominantly in the fall. And so they have shoulder issues because of instability and everything like that. So we worked on some different programs with them. So it does have to do with the time of year as well as the sports that are being played. It also has to do with different trends that they're trying. So like one thing that I noticed was one of the teams this year decided to try a new warm-up technique. And so they were doing a lot of twisting motions and having a lot of back injuries due to it. And so we were able to take that newly discovered warm-up routine, modify it so that it was more friendly on the back and the extremities, everything like that. And then we were able to see a reduction in overall injuries due to those things. So that comes out of the prehab versus rehab portion of it.
Yeah.
So definitely, good job. See, I can still teach you guys, even if you're quarantined.
No one said you couldn't.
All right. Well, I think that is a great number of questions that we were able to cover today. I wanted to thank both of my interns, Alexis and Amani, for being able to join me this afternoon and being able to take the time, go over those internship experiences, as well as what did they kind of get out of it, which was a great opportunity because even I didn't know that information. So now I have some more info on the after effects of the internship, which is awesome. So thank you so much for joining us today, and I hope you guys have a wonderful almost weekend because it's Wednesday right now, which is great, and hopefully it's not going to rain, so I'm going to keep my fingers crossed for that. I know, I'm looking
I
up.
was like,
Yeah, I was like, I don't know. It looks
That's-
pretty dark outside.
My
That's
fingers are
rain.
crossed.
It's definitely
Yeah.
gonna rain.
Yeah.
Thanks, Amani. If it rains, I'm gonna email you and be like, you did this.
I'm gonna be like, I told you.
Have a great weekend. Thank you so much for those that have joined us, and have a great semester.
Cool.
So stop and